One of the things that I always look for whenever I'm looking at a therapeutic, a diagnostic, an episodic event of care is access, outcomes, and values, right?
Right.
Because that's the way the healthcare system has to start looking at things, not just outcomes. Because we're running against a 18% GDP in our healthcare environment. It's becoming prohibitive.
Yep.
And so take me down the road of access, outcomes, and value on how the Epic platform potentially answers some of those.
Yeah, it's a great question. And I think those are definitely the right drivers. And if I were to paint a picture for you today in the metastatic breast cancer setting, let's think about that diagnostic journey that we talked about, that the patient has to go through. And what we know today is that about 30% of patients that go through that process aren't able to get answers from that process, meaning they may go through a tissue biopsy. That tissue biopsy may be insufficient, or the patient may be contraindicated. In some cases, the patients don't want it. That 30% that is experiencing that is not getting the information about their cancer that they need, so that provider can determine what the best treatment is for them. And so to me, that's an access issue that we have to do a better job. And there is more that we can do to provide answers to that subset of the population that currently doesn't have real-time information to help them. And in that situation, they may be going back several years to look at the original pathology from the original diagnosis to determine how that treatment should be prescribed. The unfortunate thing is those receptors, or the hormone receptors, as well as the HER2 receptor, can change. What's happening today may not be what was happening at the time of the original diagnosis. We have a way to inform that. If those patients don't get that answer, then they're likely to be guessing to some extent on what treatment to prescribe. And in that case, you're looking at making an investment in treating a patient with a certain therapeutic regimen that may not produce the outcome that you want. And if the outcome doesn't happen, then you're moving to a second line, ultimately third line therapy that the patient has to tolerate, spends a lot of money, honestly, on things that aren't necessarily working. And so we have to figure out a way to actually improve the system and what we can do to drive a better outcome.
Mm. And as I listen to this, I think about if I can get this high fidelity of a signal in a single blood draw, how does that then potentially be a benefit to those who are producing drug or biologic, or let's just call it products in general that can address any of these disease states in oncology, if I'm getting that higher fidelity signal in one data set?
Yeah, I think the great thing about Epic is we really bring value across the spectrum. And it goes back to what we were talking about in the beginning, when you look at the discovery side, you look at the biopharma side, and then the clinical side, is that our ability to provide that high fidelity signal in a comprehensive fashion. Because remember, we're giving you protein expression, we're giving you the genomics within the cell, as well as ctDNA. That's a nice value proposition to all the people that are out there working hard to find a way to help extend the lives of patients with cancer, and ultimately help make cancer, metastatic cancer, a chronic disease versus the way it's looked at today. So I think there's tremendous value in being able to extract that from the peripheral blood, and something that has a bunch of promise for the future for cancer patients.